Okay, let's unpack this. Imagine you glance down and notice, your urine has an unusual reddish or maybe brownish tint.
Hmm.
It's definitely not your everyday experience, right? And it might, understandably, make you pause.
Sure.
That observation is actually the launch pad for our deep dive today. We're going to explore what could be behind this change in color,
Right.
focusing specifically on two important substances, hemoglobin and myoglobin.
And what's really fascinating here is that both of these are, well, they're vital oxygen carriers in the body.
Yeah.
But finding them in urine, that signals a potential problem. Hemoglobin, that's the protein ferrying oxygen inside your red blood cells.
Okay.
And myoglobin does a similar job, but, within your muscles.
Ah, okay. Different location.
Exactly. So finding them where they shouldn't be, well, it raises some important questions.
Right. They have their specific jobs, their specific places. So yeah, having either one show up in your urine, that's hemoglobinuria for hemoglobin, and myoglobinuria for myoglobin, it isn't just like random. It's a sign something internal probably needs attention.
Absolutely.
For this deep dive, we've gathered information focusing on the biological side, the medical significance of these conditions.
Yeah, the mechanics of it.
Our mission really is to understand what's happening when these show up, what might be causing it, why it matters for your health, and, how doctors figure it all out.
Think of it like deciphering the body's signals. This unusual urine color, it's a message.
Yeah.
And we're here to kind of understand what that message could be.
Okay, perfect. So let's dive into hemoglobinuria first. In simple terms, what is it exactly?
Okay, so hemoglobinuria is when you find free hemoglobin. That means hemoglobin not inside red blood cells showing up in your urine.
Free floating, basically.
Exactly.
Yeah.
And, standard urine tests often check for occult blood.
Right, hidden blood.
Yeah, which literally means hidden blood.
Yeah.
These tests are sensitive to something called heme. Heme is the iron part found in both hemoglobin and myoglobin. So getting a positive result on that test, well, that can be the first clue that maybe something like hemoglobinuria is going on.
Gotcha. So normally when red blood cells get damaged, say in the bloodstream, that's hemoglobinemia, you said.
That's right, hemoglobinemia.
How does the body usually handle that released hemoglobin?
Well, normally when red blood cells break down in circulation, the hemoglobin that gets released is very quickly scooped up by a protein called haptoglobin.
Okay, haptoglobin.
Yeah, think of haptoglobin like a taxi, maybe.
Yeah.
It binds to the free hemoglobin.
Ah,
And this is really important because free hemoglobin on its own can actually damage tissues.
right.
Now, these hemoglobin-haptoglobin complexes, these taxi loads, they're pretty big, too big, actually, to slip through the tiny filters in your kidneys, the glomerular capillary.
So they get stopped at the filter.
Exactly. Instead, they're taken out of the bloodstream very efficiently by the body's sort of cleanup crew. That's the reticuloendothelial system, mainly happening in the spleen, which acts like a central processing hub. So the body's got this built-in system for handling normal levels of red blood cell breakdown.
That makes a lot of sense. The haptoglobin is like a safeguard?
It is.
But what happens if there's a sudden, massive breakdown of red blood cells and all those haptoglobin taxis get filled up?
Ah, okay, yeah. This is where it gets really interesting and problematic.
Mm-hmm.
When hemoglobin levels in the blood shoot up really high, haptoglobin just gets overwhelmed.
Right.
All the taxes are taken.
Right, fully booked.
So this leftover free hemoglobin, without its haptoglobin chaperone, it's not very stable. It starts to break down into smaller bits called dimers.
Dimers.
And these dimers, they're small enough to slip right through those kidney filters.
Ah, there it is.
And that's when you start seeing hemoglobin in the urine,
Hmm.
causing that, reddish color. And it's probably worth mentioning, too, there's a related condition, methemoglobinemia. It involves a slightly different form of hemoglobin, but it basically follows a similar damaging path.
So when that normal cleanup system is just overloaded...
Yeah, it's a major red flag.
Okay. So now the kidneys are facing this, unexpected flood of hemoglobin. What do? How do they react?
Well, initially, the kidneys try to help out. The cells lining the kidney tubules, they have these specific receptors on their surface called megalin and tubulin.
Megalin and tubulin.
Yeah, think of them like little docking stations. They can grab onto the free hemoglobin, try to pull it back, reabsorb it.
Okay, that sounds like a good first response, trying to reclaim it.
It is, initially.
So why does it end up causing damage then?
Well, while the kidney's attempt to reabsorb it starts out protective, it can actually turn into a big problem.
How so?
Inside those kidney cells, the protein part of hemoglobin, the globin, gets broken down. But more critically, The heme part gets processed by an enzyme called hemooxygenase. And unfortunately, this process generates some nasty byproducts. It causes lipid peroxidation, which is basically the breakdown of the fats that make up cell membranes,
Uh-oh.
and it leads to a buildup of iron. Plus, if the environment inside the kidney tubules gets acidic,
Right.
hemoglobin is much more likely to clump together. It forms these things called casts, like solid little cylinders.
Oh, wow.
And these casts can physically block the tubules. That really messes up kidney function. It's like causing a traffic jam in the kidney's plumbing system.
Wow, okay. That paints a really clear picture of how hemoglobin itself can actually harm the kidneys. So what kind of things typically cause this level of red blood cell breakdown that leads to hemoglobinuria?
Well, there's actually a pretty wide range of causes. It really highlights how different kinds of stress on the body can show up this way.
Okay.
One big category is oxidative damage.
Oxidative damage, like from what?
It can be triggered by certain medications, actually.
Yeah.
Things like acetaminophen, some forms of vitamin K, benzocaine, phenacin, phenazopyridine,
Huh.
even some animal feed additives like monansin sodium.
Huh. Medications.
Yeah. And surprisingly, even some common foods like onions and garlic can cause oxidative damage to red blood cells, at least in some individuals, or in large amounts.
Onions and garlic, seriously.
Seriously. And we also have to think about exposure to heavy metals, things like copper and zinc poisoning.
Wow.
So yeah, even seemingly everyday substances can sometimes push red blood cells over the edge.
That's, yeah, onions and garlic, that's definitely unexpected. What other kinds of things cause this?
Then you got physical agents, things like severe burns, heat stroke, crush injuries, electric shock.
Okay, trauma-related stuff.
Right. And even giving large amounts of IV fluids that are too dilute compared to body fluids, hypotonic fluids that can make red blood cells burst.
Ah.
And certain conditions that damage small blood vessels, like DIC, disseminated intravascular coagulation, or something called heartworm-Cavell syndrome, they can also shear red blood cells apart.
Okay. What about toxins, like
Yeah.
venoms?
Definitely. Toxins are another big one. Some directly attack and rupture cell membranes. Venoms from certain snakes, like the eastern diamondback or the eastern coral snake, are known for this.
Right.
And spider venom, too, like from the brown recluse spider.
It's kind of sobering, isn't it? How many different paths can lead to that same sign in the urine?
It really is.
Can infections do it too? Cause hemoglobinuria?
Absolutely.
Yeah.
Several infectious organisms target red blood cells and cause their destruction.
Such as?
Examples include things like babesiosis, certain types of leptospirosis, cytozoonosis, mycoplasmosis, quite a few, actually.
Okay.
And then there are immune-mediated issues. This is where the body's own immune system mistakenly attacks and destroys its red blood cells.
Autoimmune kind of thing.
Exactly, like an idiopathic immune hemolytic anemia, or sometimes after an incompatible blood transfusion.
Ah, yeah.
And there's a specific situation in newborn kittens, neonatal isoerythrolysis. It happens particularly if you have a type B queen cat with type A or AB kittens. Their antibodies attack the kitten's red cells.
Wow, okay. That's a lot to keep track of. Are there any, like, less obvious causes?
Yeah, there are a few more worth mentioning. Certain deficiencies.
Sure.
For example, a severe drop in phosphate levels, hypophosphatemia.
Okay.
That can sometimes happen after starting insulin treatment in diabetic patients, and it can lead to red blood cell breakdown.
Huh. Interesting link.
And then genetic factors. Some individuals are just born with predispositions,
Like what?
like a deficiency in an enzyme called phosphofructokinase PFK deficiency, or inherited problems with handling copper, which is a big issue in Bedlington Terriers, leading to hemolysis.
Right, the copper storage disease?
Exactly. And there's also a condition in Old English sheepdogs linked to exercise, exertional lactic acidosis, that's been associated with it. And one more kind of unusual one, internal bleeding behind the abdominal lining, a retroperitoneal hemorrhage, can sometimes lead to hemoglobin showing up in the urine.
Gosh. So yeah, a really wide range of underlying problems.
Definitely.
If someone does have hemoglobinuria, are there physical signs a doctor might spot? Clues during an exam?
Yes, absolutely.
Yeah.
Certain findings can definitely point towards significant red blood cell breakdown,
Like,
things like pale gums because of the anemia, a rapid heartbeat as the body tries to compensate for less oxygen getting around,
makes sense.
lethargy, just unusual tiredness, and jaundice, that yellowish tinge to the skin or the whites of the eyes caused by bilirubin buildup, which is another byproduct of breaking down red cells.
Okay, good clues, right? That gives us a really good handle on hemoglobinuria. Let's switch gears now to myoglobinuria.
Okay.
You mentioned myoglobin earlier. It's also an oxygen carrier, but in muscles.
That's right, specifically in muscle tissue. And it's actually a smaller molecule than hemoglobin. It only has one oxygen binding unit, whereas hemoglobin has four.
Mm. Ah, okay, smaller.
hmm And myoglobinuria is simply when this protein, myoglobin, shows up in the urine. It often gives the urine more of a brown discoloration rather than distinctly red.
Brown. Okay, so how does it get out of the muscles and into the urine?
Well, it happens when muscle tissue gets injured, either from, say, a lack of blood supply ischemia or just direct physical damage.
Right.
The myoglobin leaks out of the damaged muscle cells into the bloodstream. And because it's relatively small,
It slips through the kidney filters easily?
exactly, it passes very freely and quickly through those kidney filters and straight into the urine.
Okay.
And a key difference here, compared to hemoglobinemia, is that with myoglobinuria, the plasma, the liquid part of the blood, usually stays clear,
Oh, interesting. Why is that?
because myoglobin doesn't typically bind to a carrier protein in the blood in large amounts, unlike hemoglobin binding to haptoglobin.
Mhm.
So it gets cleared into the urine super fast.
Right. So you could have brown urine, but the blood plasma looks normal.
Precisely.
Okay, so it's smaller, gets filtered more easily. How do the kidneys react to myoglobin? Is the damage similar to hemoglobin?
Well, interestingly, myoglobin is also taken up by those kidney tubule cells using the same receptors, megalin and tubulin.
Ah, the same docking station?
The very same.
Mm.
And like hemoglobin, it can contribute to lipid peroxidation inside those cells.
Okay.
However, a key difference is that myoglobin doesn't release free iron through redox cycling in the same way hemoglobin does.
So one of the damaging pathways is less of an issue.
Exactly. That specific iron-mediated damage pathway seems less prominent with myoglobin compared to hemoglobin.
That's an important distinction. Now, we talked about how acidic urine makes things worse for hemoglobinuria. Does urine pH matter for myoglobinuria too?
Oh, absolutely. It's actually quite significant here as well.
How so?
An acidic urine environment really promotes myoglobin clumping together precipitation and forming those casts inside the kidney tubules.
Leading to blockages again?
Right, physical blockages. But on the flip side, alkaline urine, less acidic conditions, seems to be protective against myoglobin-induced kidney damage.
Oh, really? How?
It seems to help stabilize a particular form of myoglobin, making it less likely to cause that lipid peroxidation damage. And it also makes it less likely to precipitate and form those obstructive casts.
Fascinating. So the acidity or alkalinity of the urine can really change how harmful the myoglobin is.
It can make a big difference, yeah.
Okay. So what are the main things that cause myoglobinuria? What leads to that muscle damage?
Well, generally, the causes link back to muscle injury or inflammation. Myositis, just muscle inflammation, is a big one.
Okay.
This can be triggered by infections like toxoplasmosis or neosporosis. There's also a specific type called eosinophilic myositis, which you see particularly in German shepherds,
Ah,
and various immune-mediated types where the body attacks its own muscle tissue.
similar to the immune issues with red blood cells.
Kind of analogous, yeah. And genetic factors also play a pretty significant role here, too.
In muscles this time.
Exactly. Several inherited muscle diseases, muscular dystrophies, like the X-linked form you see in golden retrievers and Weimaraner's.
Right.
Certain types of glycogen storage diseases found in breeds like Spitz, German Shepherds, Springer Spaniels, American Cocker Spaniels.
Wow, quite specific.
Yeah. And also mitochondrial problems in muscle cells, seen in Clumber and Sussex Spaniels, maybe Old English sheepdogs too.
So again, genetics can really set the stage.
Definitely. Predispositions are key.
It seems like genetics is a big player in both, but maybe affecting different tissues or pathways.
That's a good way to put it.
What else can trigger myoglobin release?
Well, similar to hemoglobinuria, certain toxins can do it. Again, snake venoms like the coral snake, and spider venom from the brown recluse can directly damage muscle.
Okay, so some overlap there with toxins.
There is. And then physical factors that cut off blood flow to muscles ischemia, or things like severe crush injuries, compartment syndrome where swelling cuts off circulation.
Right, things that starve the muscle of oxygen.
Precisely. And finally, extreme conditions, like a dangerously high body temperature hyperthermia from heat stroke, or maybe prolonged seizures,
Okay.
and also extreme physical exertion. Think about racing sled dogs or greyhounds. They can suffer from exertional myopathy.
Ah, exertional rhabdomyolysis.
Exactly. So basically, anything that severely stresses or damages muscle tissue can potentially lead to myoglobin showing up in the urine.
Okay. And just like with hemoglobinuria, are there physical exam clues for myoglobinuria?
Yeah, besides the discolored urine itself, the findings often relate directly to the muscles.
I agree.
You might find muscle tenderness when touched, sometimes even visible bruising over affected muscle groups. It directly points to that underlying muscle damage.
Right, that makes sense. Okay, so we've got these two conditions. Both can cause discolored urine, both can potentially harm the kidneys. How do doctors actually tell them apart?
Yeah, that's the critical next step, isn't it? Because a simple urine dipstick, like we said, detects heme.
Right, it just says heme present.
Exactly. It can't tell you if that heme is from intact red blood cells, free hemoglobin, or myoglobin. So you definitely need to investigate further.
What about visual clues? You mentioned the plasma appearance earlier.
Mhm.
Can that help?
It could be a huge help. Looking at the patient's blood sample and the urine side by side gives valuable clues.
Okay.
So if the plasma is clear, but when you spin the urine down and look under a microscope, you see red blood cells or their remnants, ghost cells,
Uh-huh.
that strongly suggests simple hematuria. Blood is just leaking into the urine from somewhere in the urinary tract itself, not from breakdown in the bloodstream.
Okay, blood from the tract, not in the blood.
Exactly. But if the plasma itself has a reddish or pinkish tinge,
Ah,
that points towards hemoglobinuria. It means there's free hemoglobin circulating in the blood.
got it.
And if the whole blood sample looks kind of dark, chocolate-colored, that might suggest methemoglobinemia.
Okay.
And crucially, if the plasma is clear, but the urine is brown, and you have other evidence of muscle damage like high muscle enzymes in the blood,
Right.
then myoglobinuria becomes the prime suspect. So yeah, the visual picture is often quite informative.
So appearance is a big piece of the puzzle. Are there specific lab tests that can definitively separate them?
Yes, definitely.
Yeah.
There are lab tests that can help nail it down. One classic method is the ammonium sulfate precipitation test.
How does that work?
You add a specific chemical solution, ammonium sulfate, to the urine sample. Hemoglobin isn't soluble in it, so it precipitates out. It forms a solid sediment at the bottom.
Okay.
Myoglobin, however, stays dissolved in the liquid part, the supernatant.
Oh.
So if you spin it down and see a dark reddish pellet and the liquid above is clear or pale, that suggests hemoglobinuria.
Right.
But if the liquid above the sediment stays dark brown, that points strongly towards myoglobinuria.
Clever. Simple chemistry.
Kind of neat, yeah. And of course, measuring levels of muscle enzymes in the blood is critical. Things like creatine kinase CK and aspartate aminotransferase AST.
Right, the muscle damage markers.
Exactly. If those are really high, it strongly supports muscle breakdown or rhabdomyolysis, which you see with myoglobinuria.
Okay.
And remember haptoglobin. We mentioned that levels are usually low when there's significant hemolysis happening within the blood vessels. So checking haptoglobin can also help support a diagnosis of hemoglobinuria.
Got it. So these lab tests add more certainty.
They provide more definitive answers, yes.
Are there things that can mess up these tests? Give false results?
Yeah, there are always potential pitfalls, things to be aware of.
Like what?
Well, for the dipstick test, taking high doses of vitamin C can sometimes cause a false negative for blood.
Oh, interesting.
Conversely, you can get false positives from things like certain bacterial enzymes in a contaminated sample, oxidizing cleaning agents, maybe leftover free hemoglobin from a recent blood transfusion,
Yeah.
or even some of those artificial blood substitutes, hemoglobin-based oxygen carriers. Also, if the urine is really, really dilute, red blood cells might actually burst in the test tube after collection, which could look like hemoglobinuria when it's not.
Oh, an artifact.
Exactly. And some preservatives, like formalin, can occasionally interfere and cause false negatives too.
Oh.
So yeah, you have to interpret results carefully in context.
Okay. So it really sounds like getting the right diagnosis needs like the whole picture. Patient history, the physical exam findings, and then interpreting these various lab tests carefully.
Precisely. You need to put all the pieces together.
So bottom line, why does it really matter if it's hemoglobinuria or myoglobinuria? What are the dangers we're worried about?
It matters a huge amount because, as we've discussed, both free hemoglobin and myoglobin can be toxic to the kidneys,
Right, the kidney damage.
especially if kidney blood flow is already reduced for some reason, or if the urine is quite acidic. That damage can range from, mild kidney injury all the way to acute kidney failure, which is
Yeah.
obviously very serious, potentially life-threatening. So figuring out which one it is, and more importantly, what's causing it, is absolutely crucial for choosing the right treatment and protecting kidney function.
And what does treatment generally involve then?
Well, the immediate focus for both conditions is usually supportive care for the kidneys.
Okay.
That typically means giving lots of intravenous fluids, toward IV fluids, sometimes with added bicarbonate if the patient's blood is too acidic. The goal is to basically flush the kidneys, dilute those damaging proteins, and try to prevent them from forming casts and causing blockages.
Makes sense. Keep things flowing.
Right. But beyond that initial supportive care, the specific treatment really depends entirely on tackling the underlying cause.
So it's very targeted.
Extremely.
Hmm?
If it's a toxin, you need to stop the exposure and maybe give an antidote if one exists.
Mm,
If it's an infection, you need the right antibiotics or antiparasitics.
right.
If it's an immune issue, you might need medications to suppress the immune system. Genetic conditions might need specific long-term management plans. So finding the root cause is everything.
It really underscores that importance, yeah. You also mentioned earlier that breed and history are particularly important. How do they fit into the diagnostic process?
Oh, they're huge. A really thorough history, including the animal's breed, can give you massive clues.
How so?
Well, knowing the breed might immediately flag potential genetic risks, like we talked about with Bedlington Terriers and copper, or certain breeds prone to muscular dystrophies or exertional myopathies.
Right, raises your suspicion index.
Exactly. And the history. Asking about recent medications, potential toxin exposure, maybe they got into the cleaning supplies or ate something weird in the yard,
Mm,
or asking about recent strenuous activity or signs of illness. All that information helps narrow down the possibilities dramatically and guides which tests to run first. It's detective work.
yeah, absolutely. This has been incredibly insightful, thank you. Just to kind of wrap up, what are the absolute key distinctions between hemoglobinuria and myoglobinuria we should take away?
Okay, the main things to remember are: 1, the source.
Mm-hmm.
Hemoglobin comes from red blood cells. Myoglobin comes from muscle.
Source.
Got it.
2, the molecule size. Myoglobin is smaller than hemoglobin.
Size.
3, the plasma appearance. Hemoglobinuria often causes reddish plasma. Myoglobinuria usually leaves the plasma clear.
Plasma color.
And 4, the typical causes. While there's some overlap, like certain toxins, the most common triggers for each tend to be different. Think hemolysis triggers for hemoglobinuria, muscle damage triggers for myoglobinuria.
Perfect. Source, size, plasma color, and common causes.
That's a good summary.
So while, noticing that unusual color in your urine might be the very first thing, it's clearly just the tip of the iceberg, isn't it?
Oh, absolutely.
It's indicating something much more significant could be happening deeper inside the body.
Exactly. And I think recognizing that huge range of potential causes, from things that seem relatively minor, like certain foods maybe, to really serious infections or genetic issues, it just underscores how complex and interconnected our body systems really are. Yeah, absolutely. Which leads us to our final provocative thought for you listeners. Consider how seemingly different events, maybe enjoying a meal heavy on garlic or pushing yourself to the limit in a marathon, could potentially lead to a similar warning sign showing up in your urine.
Mm-hmm.
It kind of prompts us to appreciate the really delicate balance within our bodies, right? And the importance of paying attention when it sends out these signals. It makes you wonder, what other seemingly unrelated factors might be having unexpected impacts on our internal environment?
It's a fascinating thought. It reminds us just how much is constantly going on under the surface, all those adjustments our bodies make constantly to try and keep everything in equilibrium.